A common question is that I think I have varicose veins and spider veins, but I'm not sure, or what should I do to help find out? Well, the first thing is just looking at your legs and seeing if there's obvious visible varicose and spider veins. But I would be quick to add that about 5% of patients who have really no visible evidence of varicose vein disease at all, yet do have it clearly evident on ultrasound. Another thing to consider is what kind of symptoms are you having? Are there symptoms that are commonly related to varicose veins? For example, aching, very common symptom of the varicose veins, heaviness, fatigue, swelling, itching, burning, cramping, throbbing. Pain caused from varicose veins tends to be along the entire course of the leg, as opposed to, for example, in the joints, or the ankle, or in the foot, or in the hip. Those tend to be more musculoskeletal causes. But when the symptoms are kind of more diffuse through the leg, they're more likely to be from varicose veins. And the symptoms of varicose veins typically are better if you elevate the legs, improving venous return. They also tend to be better if you exercise, and that has to do because of our normal venous function. We're designed to stay moving. Anti-inflammatories sometimes actually can also help with varicose veins because the symptoms of the pain is a result of inflammation of the veins, and so they can be helped sometimes by ibuprofen or Aleve. But ultimately, the determination of whether varicose veins are present or not is very much dependent on ultrasound. You can have veins in the legs, for example, that are bulging, but that are, and very prominent, but are actually normal veins. And you can only tell that on ultrasound. And on the other hand, you can have veins where there's really nothing there but the presence of symptoms, and you can find it very obviously on ultrasound. So ultrasound's the final determinant, and that's what dictates all care.